maybe 20 years from now, at least in rich societies, it will be considered irresponsible to have just any child that comes by random events, is when you have the possibility to select a good one through this procedure.
Yeah, I have two questions for Professor Jordan. This progress give us the image that these things can be done for fancier reasons. But the same technology probably in certain culture, certain society will be used for a very traditional, simple reason, simple causes. For example, I can expect that maybe for this kind of fast screening technique, there are probably more couples they are concerning to use this for only for sex selection detection. So the old issues, okay, with the new method to do that will change the scenario, because currently, okay, even the government, they are, for example, the Bureau of Health Promotion, they are quite concerned of the sex ratio. Okay, they have been monitoring and try to intervene certain like the obstetrician clinics. But in the future, a couple can simply avoid this. Okay, they can go to simple lab or do the DTC method. So at the same time, when we are thinking about the more complex traits, but for these kind of traditional or even cultural urgent issues, we probably need to think it again.
Yeah, because I guess some sex determination by ultrasound can only be done later. So the determination is more traumatic.
And that leads to the next question, probably we should all concern. So for all those new progress, and for example in Taiwan, so who should be watching or who should be discussing? It should be from the medical profession itself, or maybe we should expect that the pharmaceutical company also need to have some code of practice, which ethics should be emphasized a lot. And what kind of process or for discussing and having some projects guideline? What is the governmental roles? I think that's probably more important.
Yeah, I agree with you.
I think the very important thing I like to bring up is, actually, the baby come up with different characteristics like height, weight, or intelligence, or disease, or whatever. Okay, that's the phenotype. Okay, but what determines the phenotype? Of course, the genotype is very important. So now, with all of those techniques, we can know the genotype very, clearly and very comprehensively. But you should know that from genotype to phenotype, there's two very important factors. The one is environment. Okay, they will affect the process of development. Okay, even the same phenotype, when the environment is different, the phenotype will be different. Another thing is stochasticity. That is the chance. Okay. So I think you must be. I think the very important thing to know is to convey to the patient, to the parents, to the public is even if you know all the genotypes, you cannot very sure about phenotype, because there is a very complicated process of development. Okay, up to now we did not know where is the development information located in the genome. Nobody knows. That's the dark matter of the genome. Okay, and of course, if you have some infections, if you have some anything else like what we eat very much now, the 毒淀粉, okay, it might be in somewhere influence this because. For me, I think the most difficult, most challenging discipline now, as far as I know, is the development. Okay? And of course, there's a chance. There's a chance. Okay? There's always a chance. So one day, they asked me whether we can tell, because there's, monozygotic twins, he said, how can you differentiate to monodiagnostic twins? I think I told her that you just look at the fingerprint. Your fingerprint is random, okay? It's not determined by your genotype. Even if they have the same genome, the fingerprint is not different. It's different. So I think you must have a very, because now we think that as long as we know genotype, we can predict the phenotype. Of course, in terms of a single mutation, single gene disease like thalassemia, cystic fibrosis, yes, it can be done. But for most of our phenotype is complex trait. So this is very important. So we must convey this. I think today is a very good occasion because you are very highly concerned about this issue. Genotype is not equal to phenotype. Okay, so I think this must be a priori information. Okay, is there any more questions? No, let's take a break. Okay.
We have a 10 minutes break. The next session will be from 20:10. 我们邀请其实坐在外圈的哦，尽量坐到内圈来，就是这边有比较舒服的椅子，大家请不要客气。My father and uncle but one has 7 children. Another has no children.
That's a good idea.
Yeah, sure, but老师好，哎，好，老师好，老师好，我现在在医研部，医学研究部，对，院病理，对，谢谢。